with regard to ICU patients. Thank you.
Mama Nairobi.
Thank you, Mr. Speaker. To the CS, through the Speaker, I want to talk about what Honorable Awanda was talking about. It's children. We know that in Kenya we have a lot of defiled children and a lot of children who engage in sex before they reach the age of 18. We have a serious problem in that if a family has the NHIF, the SHA cards, medical cards, you've got the wife, you've got the husband, and then you've got the children. If the wife has given birth, right, and the daughter 2-3 months later is giving birth because she was defiled, the system has no way of picking that child and giving her the right cover because she's a minor. And we know that during the pandemic, we had over 300,000 minors that got pregnant through defilement. Now, that's problem number one. How do we address giving services to a minor who has been defiled and is giving birth under a medical card that is actually owned by her father and her mother has given birth? So in the same family unit with the same membership number, how do you accommodate that minor to get the right services? The next thing, when it comes to the same minor, this is a minor who's probably 10, 11, 12, who has given birth because of defilement. And the society will look at her as an adult. They will look at her as a full-grown woman, yet she's a minor. By the age of 18, this minor will have been defiled and misused over and over and over again. We buy commodities as a country. I want to know whether you would ensure that that minor is counseled and put into a family planning program so that she doesn't have a child at 13, 14, 15, 16, and then before you know it, she's wasted her life, no education, and she's a burden to her family, and the children are a burden to her. And then we also have a big problem with the abortion guidelines. The court has given a ruling that the abortion guidelines have to be released by the ministry. Could I know whether this will be based on your religious beliefs or whether you as the CS will do the right thing and ensure that guidelines to abortion, which is permitted under the Constitution and has been spoken to by the courts, will be released so that we can have safe abortions where required. Thank you.
Which constitution are you quoting?
Article?
Which constitution are you quoting?
Article 26(4) permits abortion.
Abortion is illegal and except under very stringent circumstances.
Yes, but there is no guidelines issued under those stringent circumstances. And the courts have pronounced themselves saying that... Article 26(4), thank you. The courts have pronounced themselves on that issue, that the emotional state of the mother, the emotional state, the physical and the social states are also supposed to come into consideration. There is a live ruling on that in the case of JMM, which I will gladly share with the CS for him to become acquainted with that. I know that the church is fighting it, but right now, if a woman is supposed to procure a safe abortion and the doctors want to do it, there are no guidelines. So doctors don't do it, and the woman dies because there are no guidelines. And yet the doctor knows that this woman should actually have a safe abortion. If you go to KNH right now, in the wing for abortion, medical care for post-abortion, it is full. We spend over 500 million to $1 billion post-abortion care. Women are suffering because of unsafe abortions. Let us be a civilized country.
You are making a speech.
Yeah, okay, thank you.
Minister,
I think the point is...
Minister, can you now respond to those 10?
Speaker, let me start with my good friend, the woman rep of Nairobi. All these abortion, emotions, all these are coming to this house. There is a reproductive health bill that is coming to the house. I'm just going through it, and a lot has been done by Honorable Mili Odhiambo when she was and very passionate. She's very passionate when I was the leader of majority. And there are a number of policies. I will engage you and we. And as the speaker has said, abortion is illegal under certain medical conditions those medical conditions, the framework, the director of medical service, the head of the technical advisor on technical matters to government, and the CS is on my left, Dr. Amoth, who this house has vetted. On teenager mothers, I can only deal with the question that Honorable Owundo also has asked. It's more. Teenage mothers is another national conversation. The numbers are huge. It is a conversation, national conversation, for the leadership in this house, for religious leaders, but for SHA, we are giving them special temporary cards. They don't need to use their mother. If they deliver on the same day, the mother will use her SHA card, and the lady will use her temporary card. Honorable Owundo, I agree with you. I mean, you are at the border. It's very complicated. How do you identify a teenager who crosses from the neighboring country? But I want to assure you that we have a way of giving, even when neighbors cross, they have alien card. So we will use the alien card as we give temporary card to our ladies. On indigents, as we, government, look at the social health, social protection data to make sure that it's clean, even the elderly people who are getting 2,000, we want to find out, are they indigent? Some of them might not be indigent. Some of them might not even require that. So we are in the process of doing mean testing for the national government and the county governments, and you will help us. Because even in your constituency, you might find indigents that you want to pay either through NGAF or through the national government, CDF. Honorable KJ, sensitization, yes. I know you have a communication background. But ask yourself, every day, as we sit here, Mr. Speaker, on our dashboard, 40,000 Kenyans has registered as of now. So, per day. And out of the 40,000, we can tell how many have gone through the mean testing and how many have paid. Like yesterday, we had 47,000 Kenyans who registered online. 18,000 of them went through the mean testing and paid close to 18 million. So you see, is that the average is about 1,000. But I want to assure this house, because universal health care, we meant for the 80% Kenyans who were not accessing NHIF. NHIF was colonial. NHIF was a club of the salaried people. 20% were accessing. This universal health care, SHA, wants to bring on board the 80%. And that's why we're doing the mean testing. The bottom of that mean testing, the bottom that somebody will pay, will be 300. And I want to give an example of Mr. Speaker. Mr. Speaker, I really want you to allow me to use you as an example, if you allow me, Mr. Speaker. Mr. Speaker, you pay NHIF now, I mean SHA, you are paying 47,000. The Speaker of the National Assembly.
47,800.
47, to be specific, 800, based on the 2.7% of his income. The good lady, the maid, the house girl who cooks for him, who earns maybe 5,000. I'm giving an example, Mr. Speaker. I'm not saying you give her 5,000. You might be giving her more. But I'm giving an example. Minimum wage, 5,000. I'm just, it's hypothetical. I'm just using 5,000. That lady, if she pays 300 or 500 SHA, and she wants to go and deliver in Pumwani maternity, SHA will pay 30,000 shillings. She will deliver and she will walk home with her baby. She will not pay a coin. Mr. Speaker, If your wife